New alarming numbers shining a grim light on just how much stress Georgia hospitals are under in regards to COVID-19. According to the White House COVID-19 Task Force report, we are second in the nation for the most COVID-related hospitalizations. Right now, more than 5,500 patients are sitting in facilities battling the virus. One hospital situation is so severe, it's asking the governor to step in. Chinu Her joining us live this morning from Newnan Piedmont Hospital, where they are pleading for help from the governor. Chinu.
Yeah, they are badly in need of help right now. And earlier this week, Governor Brian Kemp deployed 105 guard personnel to help at 10 hospitals across the state. Now, Piedmont Newnan becomes the 11th hospital. Chief Medical Director Robert Miller says Piedmont Newnan Hospital asked Governor Kemp for the help on Thursday, and their request was granted. Now an unknown number of personnel is coming to help as early as Friday. He says their ICUs and waiting rooms are backed up.
We're at 128% of our capacity, and the only thing that's preventing us from expanding anymore truly is lack of nurses.
Miller says compared to the last COVID wave from January, critically ill patients are up 26%. Patients on ventilators are up 76%. Miller says of all those people, 96% of them are unvaccinated.
We really need sort of medics to help triage the people in the emergency room, to help start IVs, check vital signs, and just, we're backed out into our waiting room of our emergency room.
Yeah, and something else that's affected right here at the hospital because of this are elective surgeries. That's something that is being put to the side right now. However, emergency surgeries are still continuing. Miller says they hope that this gets better in the next couple of weeks.
Chinu, get this. Yesterday on Instagram, I saw an oncologist post that all breast cancer surgeries had been canceled unless death was imminent within the next 24 hours. That is some real perspective on how this situation is impacting so many people. Thank you, Chinu. Right now, the Department of Health has an unusual request. Don't call the ambulance. Madison Carter has more on the plea and how this is also impacting our local hospitals.
Yeah, Aisha, there's a lot of what you were just saying. State officials are saying that emergency departments are being so stretched because of the overwhelming amount of COVID patients. Right now, a lot of these ERs are sending patients elsewhere. It's because so many are unable to provide normal emergency care to patients who are coming in by ambulance. The Department of Public Health says if you're having a medical emergency, you should still call 911, but only take that ambulance if you absolutely have to. State health officials are also asking you to go somewhere other than the hospital if you need a COVID test just because of the strain on resources. And the education system in our state is also seeing a strain and a surge of cases. A number of districts have been implementing changes weekly. We have been bringing you those updates day by day. Starting September 6th, the Atlanta Public Schools will require staff to get tested for COVID twice a week. APS reports 330 students and 56 staff members tested positive just last week. Masks are already mandatory here. Officials say staff members who choose to not be tested could face disciplinary action, but no one is going to be fired. Those who consistently follow this policy will get sick pay if they catch COVID-19 or have to isolate due to exposure. And Decatur City schools look like they're going to go ahead with plans to require staff to be vaccinated against this virus. The school board says all members agree vaccines are critical to protect staff and students. Members say they don't believe they legally have to bring this to a vote for a staff mandate, but they would have to do that on a student mandate. The board is asking the superintendent to draft a new policy so they can discuss this a little bit more and get approval. Aisha.